Hi everyone, my name is Jem Porcaro. I'm the Senior Director of Energy Access at the UN Foundation. This is the second in a series of conversations that the Practitioner Network is having with entrepreneurs and practitioners who are making it really their mission and business to make sustainable energy for all a reality. Today I'm really pleased to be with Dr. Laura Stachel, who is the founder of a very innovative and unique company called We Care Solar, who has made it their mission to light up health facilities around the world. So Laura, we are here in Bonn, Germany at COP23, the UN Climate Change Conference. There's a lot of discussion around the importance and need of transitioning to a more sustainable, equitable energy future. Your company is part of this transition. I was hoping you could say a little bit about your company, what sort of problem you're trying to address, how are you going about that, and then we can kind of ask a few more questions after that.
Sure, well thanks for having me. So our organization is called We Care Solar. We're actually a nonprofit organization based out of California, but trying to address the issue of unreliable electricity, in particular in maternal health facilities. I myself am an obstetrician. I first became aware of the role of energy poverty and maternal mortality when working in Nigeria in 2008, and I was struck by the fact that even large state hospitals were subject to sporadic electricity because of load shedding, which meant that health practitioners were forced to use candles, kerosene lanterns, or diesel generators when they had fuel, which wasn't often, but very often the hospitals were completely in the dark and unable to provide care. Patients were turned away at night. Women couldn't get blood transfusions in a timely fashion. The hospital that I was working at that time was losing 3 to 8 women from pregnancy and childbirth complications every month. And our first project was to bring solar electricity to the maternity ward, to bring in a blood bank refrigerator, and to bring in power to the operating theater. And we saw a 70% decrease in maternal deaths at that facility over the next year, a 16% increase in ability to see patients at night, and those numbers have only gotten better over time. I spoke to people from the hospital several months ago, and they said in the last year, the total deaths in the entire year was 2, which was kind of unheard of. So we really got to see the transformative power of sustainable energy using a free source of fuel like the sun. What I hadn't realized at the time was that there were actually hundreds and thousands of health centers in sub-Saharan Africa, in Southeast Asia, that actually face the very same challenges. And so what we tried to devise was something that would be a robust solar electric system that could be brought to scale. And the model we're using is something called a solar suitcase. It's a compact, rugged solar electric kit that's complete. It has solar panels, charge controller battery, as well as energy efficient lights, energy efficient fetal monitor to check for baby's heart rate, phone charging, 12 volt DC electricity for other medical appliances, and it even has things like the hardware to do installations, because we're trying to address last mile health centers that may have no access to things like a hardware store. So even just getting a simple screw or a bolt or something to really make an effective solar installation can be very challenging. In addition to technology that's robust, though, we found that education is very important, that we're trying to build local capacity so that people in their own countries can be the solar experts, the solar installers. So we created training programs, we created videos, we created photo-rich guides, and we created a group of women solar ambassadors to lead the trainings for this, so that women are not only the beneficiaries of having reliable electricity, but they're also the ones that are helping to carry the torch and to, lead the energy revolution in Africa and Asia. So those are some of the things that we've been doing. Just to mention the kinds of results that we've seen when health centers have something even as modest as a small solar electric kit, because our solar electricity is, we like to call it the first 100 watts to last mile health centers. Mm-hmm. Even something as small as that can make a transformative difference. Healthcare workers say they're no longer afraid to work at night. They feel that they have more confidence in doing procedures. They're no longer asking mothers to pay for kerosene or to bring in candles, or seeing women staying at home because they're afraid to go to a darkened health center. They're not delaying procedures to morning. They're able to recognize complications when they begin and transfer patients appropriately to higher level centers when they need to. in my dream of all dreams, we would basically electrify an entire health center and not relegate our electricity to focus on just the delivery room. But as far as having a solution that can scale immediately, that's easy to use, robust, and something that can start to reach the hundreds and thousands of delivery rooms that are in darkness, I think it's been a very effective first step.
Very effective indeed, and because we've had the benefit of working together in the past, I know that you've deployed many of these solar suitcases across Africa and Asia, which means that you've amassed a lot of experience in doing so. I'm curious, can you share with everyone an example of one success that you're proud of, and also one challenge that perhaps you've learned from as you've, over the years, developed and deployed your solutions?
I would love to. So one of the ways that we work is to actually work in partnership with agencies that are already on the ground that are working to strengthen healthcare. So we might work with a partner like UNICEF or Save the Children, JPIGO, AMREF, groups that are already thinking of ways to invest in maternal and newborn healthcare, but they haven't already considered the energy access portion of the equation. So that means that we're very reliant on partners, and we've had to get more and more savvy about how to choose effective partners, because our programs went from doing 2 solar suitcases or 10 at a time to now we do hundreds at a time. So we need partners that actually can handle that kind of capacity, that are willing to have us lead educational workshops, that have good relationships with district health officials, because we also train local district health technicians to be understanding the technology so they can sustain these over time. So it's been very effective for us, I'd say, to work with partners, but we've also become a lot more choosy about who the partners are. We've done our own due diligence to make sure the partners do have capacity, do have infrastructure, so they're not overwhelmed with something like 100 solar suitcases arriving at their doorstep in need of deployment. One of the things that we've also realized is that in our early programs, we would talk to ministries of health who very understandably would like to put a few solar suitcases dotted around a country so that they were being kind of equal opportunity to many districts, which is understandable from a political standpoint, but from a logistics standpoint, it makes it really hard to do large deployments when you're spending much of your time driving hours between districts. And so now what we try and do is deeper saturation, trying to cover all of the health facilities that need solar lighting within a district and then move to another district. We're building upon that now in a countrywide initiative. It's called Light Every Birth, and we're saying why not go beyond district by district and think about lighting up an entire nation. And the first government to sign on this initiative with us is Liberia. We don't believe the solar suitcase is the right answer for every health facility, but we believe by building a coalition of partners, people that are working at different levels with renewable energy for healthcare, we really can, in our lifetime, see an entire country have safer childbirth by having energy access. So one thing I would say to you and the other partners out there is, if you are interested in focusing on maternal health care, please talk to us. Please join our Light Every Birth Coalition. The first country, as I mentioned, is Liberia. Next, we're looking at Uganda. But we're going to be going country by country, trying to sort of change the face of Africa to have a really great success story to show that mothers and newborns are prioritized in the fight for energy access and they're not forgotten.
That's great. Just wanted to follow up on this issue of scale and priority. I know we've spoken in the past about the importance of financing, finding both public and private finance for initiatives like this, moving from the tens to hundreds to the thousands. What do you think it's going to take to unlock additional financing for this? Is there a lack of evidence around how important these interventions are, or are there other missing ingredients to unlocking financing for this?
You're the perfect person to help think through this with me, because this is really, the million-dollar question. If we estimate that there's 200 to 300,000 health facilities without reliable electricity, it probably will take no more than $2 to $3 billion to actually solve this problem, which is a solvable problem. We need to sort of get the political will there. One of the things that's been challenging for us, and I think UN Foundation probably has done a little bit better job, is how do we work in an intersectorial way with government agencies that include the ministries of energy, health, finance, planning, and we're trying to do this living outside of the continent. So I think that puts a pretty high bar for us, to try and solve. And we're dealing with countries that have very limited budgets, that already have challenges with infrastructure, and then we're coming in saying, please make this a priority when there's lots of other priorities at once. I think by having UN support, which we're getting, we just won a Momentum for Change award here at COP23. We've won UN DISA award in the past. By getting the UN to back this, and I've spoken at the United Nations, so have you, getting ministers to say, yes, this is something we want to see. I mean, what is more compelling than the idea of lighting up childbirth? When a mother survived childbirth, her infant's more likely to survive infancy. Her child is more likely to go to school and to get educated and to be well nourished. Her whole family is likely to be more productive. It's helping to bring families and communities out of poverty. So it's such a central issue. It taps upon so many of the SDGs that I think, we just need to brainstorm. You out there can help us. How do we really bring in the political will to unlock the resources to have this be just a huge win-win-win? Win for climate change, win for communities, win for poverty alleviation, and show that within our lifetime we can literally light up every birth.
That's great. So it sounds like we need the evidence, we need coalitions, we need to be able to bridge these different sectors, and we ultimately need the political will. And we look forward to working with you and everybody else who's interested in this as we build out this coalition, we build out this cause.
And we're building out the evidence base. I know both through UN Foundation, through our own organizations, we actually are doing on-the-ground studies now to try and better quantify the impact of reliable electricity on the accessibility of healthcare, on the reliability and the quality of healthcare. We're doing a randomized control trial in Uganda. We're doing another study in Liberia. You're working, I believe, in Ghana.
We're working in Uganda and Ghana, so I look forward to kind of teaming up and sharing notes. And I think that is definitely something the UN Foundation over the next several years will be doing, is trying to commission more research, collate all of this research, stories that our partners are generating so that we can put together a really compelling argument to key decision makers around the importance of investing in this. So,
right,
absolutely.
So if any of you watching are interested in collecting data to add to this rich database, please contact either one of us, because I think that we really are interested, in addition to having a list of practitioners, we really do want to be collecting a lot of data. Our other choice would be to talk to the decision makers, turn off all their electricity for a week and see how they like to function in their own offices.
well, with that, I think we're going to probably wrap it up. Laura, thank you so much for sharing your story with us, and we look forward to working with you.
Thank you so much.
All right.